As you may know, many outbreaks of measles have popped up around the country. 1,022 cases have been reported by the CDC so far this year. We are seeing the worst outbreak in measles since 1992 and since measles was declared eradicated in 2000. The CDC even threatened to remove the eradication status from measles this year, despite the existence of a safe, highly accessible, extremely effective vaccine. The measles vaccine is a necessary tool for public health and safety. The Supreme Court ruled that it is constitutional to punish people who refuse vaccines and potentially vaccinate people by force. When the threat of a disease looms, it trumps any individual's freedom for the greater good. Mandatory vaccines are necessary as soon as possible because of the influence of the anti-vax movement. The most recent example of forced vaccination was in Pennsylvania in 1991, when 1,400 people got measles and many children died. A few churches were practicing faith healing in Pennsylvania, and after the outbreak, the city planned to forcibly vaccinate all of the members, but they all complied before any force had to be applied. Parents will often vaccinate when the law tells them to. One pastor at the aforementioned churches had vaccinated their dog because the law said so, but not their child, who died of a vaccine-preventable disease that was regularly administered at 2 months. Laws are effective in fixing vaccination issues. In the 1990s, many homeless men in New York caught multi-drug resistant tuberculosis. When they refused to take antibiotics, they were held involuntarily in a hospital and forced to take medicine until they were no longer contagious. City and state health officials often have more power than one would expect. One New York health official, when asked what the limits of his powers were, answered that he could turn City Hall into a hospital if he wanted. Many laws were written in the 19th century when cholera, smallpox, and yellow fever swept across cities and killed thousands. Smallpox vaccination was made mandatory in Europe as early as 1806. The first example of mandatory vaccinations in America, however, came in 1906 in San Francisco. The city nearly exploded into riots, and this legislation was necessary because the plague, which was rampant in China at the time, had spread to America. It first showed up in Honolulu's Chinatown. Quarantines were enacted, as well as the burning of many houses that left Chinese people homeless. The Chinese residents in California were very scared because there was a lot of anti-Chinese racism in the state at the time. The Secretary of Treasury was also scared and requested that no Chinese or Japanese people be let in or out of Chinatown. Briefly, nowhere in the country were Asians allowed on public transit. The plague vaccine was invented 3 years later by an Orthodox Jew. His vaccine, the half-kind vaccine, was forced upon strictly Chinese people for no medical reason. Racism played into how we used to deal with epidemics. Another injustice occurs when we start to fine people for not getting vaccines. The result of the first ever fine for not getting a vaccination was $5 in 1906. New York is talking about implementing an $1,000 fine today. This is, of course, not including exemptions for medical reasons. Fines make it so one can pay their way out of vaccines. For a wealthy family, $1,000 might not be an issue, but it is certainly a lot of money for the majority of Americans. Even then, if the goal is herd immunity, the deterrent must be higher stakes. Some people think it should be considered a crime to not vaccinate your children, as some people see it as child endangerment. But there is precedent for giving jail time for failing to vaccinate children as it has happened in the past. For now, the law says that unvaccinated children cannot enter elementary school, as it is appropriate punishment because that is where everyone gets sick. School is also an invaluable resource. But even this punishment does not work in the real world. In over 10 states, we allowed children to enter without vaccines or exemptions. In at least one state, kids without either exemptions nor vaccines outnumbered kids with exemptions. Certainly, many states are like this, but only a few report this data. When we examine the many cases of measles outbreaks around the country, we see that they cluster geographically. In New York, there have been over 800 cases of measles this year. A big portion of these measles cases are within an ultra-Orthodox Jewish community, wherein vaccination rates are low. Here we have found the source of the issue. While there is a federal law that states that nobody can attend public school or daycare without certain vaccines, it is possible to acquire a vaccine exemption if one has a medical, religious, or philosophical reason. Many people in this community use religious exemptions from vaccines and are now part of the epicenter of the worst measles outbreak in 3 decades. New York is also the place where we see a lot of attack from anti-vaccination groups. This is intentional. Earlier this year, there was a rally held an hour north of New York City that featured leaders of the anti-vax movement. This event was attended by many Orthodox Jews, many of which were told to keep their children home from school because they lacked vaccinations. The mix of vaccines being against the religion of many New York City residents and an intentionally large presence of the anti-vax movement led New York to sign a bill just last Thursday banning religious and philosophical exemptions from vaccines. The bill was signed by Governor Cuomo and is effective immediately. Cuomo said, quote, "I understand freedom of religion. We all do. We respect it. I've heard the anti-vaxxer theory, and I believe both are overwhelmed by the public health risk. Students now have 30 days to prove that they have the appropriate dose. Many anti-vaxxers claim freedom of religion, question the effectiveness or safety of vaccines, or threaten to leave the state, saying, 'People came to this country to get away from exactly this kind of stuff.' An assemblywoman said, 'I believe in science. Your personal opinions, which may be based on junk science, do not trump the greater good.'" Which brings us to our next case, California. California had a measles outbreak at Disneyland a few years ago, and it spread throughout the country. California promptly passed laws banning religious and philosophical exemptions. This has resulted in a rise in vaccinations and a decrease in measles cases. Measles is one of the most contagious diseases. In an unvaccinated population, one sick person can pass measles on to between 12 and 18 people. This is why herd immunization is important. Herd immunization is what would have protected many of the measles cases where the patient was vaccinated, as well as many of the cases where the patient wasn't vaccinated. Herd immunization is where a large enough percentage of the population is vaccinated, so the remaining unvaccinated people won't get the disease. Herd immunization is what would have allowed people to safely have religious exemptions if they hadn't lived within close proximity of each other. What is the suspected case of the outbreak in New York was a traveler from Israel, where there was a more serious outbreak. Infected somebody in the Jewish community in New York, and it spread from there. If a high percentage of that population of New York had been vaccinated, the disease wouldn't have spread as it did. Herd immunization protects individuals that cannot get vaccines for medical reasons as well as anybody else, because they are as much less likely to come into contact with the individual with measles. Herd immunity is good.